Across our planet, an unseen epidemic silently claims wildlife lives. While predators and habitat loss are visible dangers, chemical contamination poses a pervasive, insidious threat. From agricultural fields to bustling industrial zones, toxins infiltrate ecosystems, turning sustenance into poison for unsuspecting animals. This documentary delves into the critical, often heroic, work of wildlife rehabilitators, the dedicated individuals who become the last line of defense for creatures caught in humanity's toxic wake. Their mission: to intercept, diagnose, treat, and ultimately, release these innocent victims back into the wild, if recovery is possible. The journey for a poisoned animal often begins with a concerned citizen. Someone spots a bird unable to fly, a raccoon disoriented by a roadside, or a squirrel convulsing erratically. These are often the first, heartbreaking signs of toxic exposure. The immediate response is crucial. Every minute counts when an animal is suffering from internal poisoning. Callers are often guided on how to safely contain the animal without risking further harm to themselves or the creature, ensuring minimal stress before professional help arrives. This initial contact is the critical bridge from discovery to medical intervention. Upon arrival at a rehabilitation center, the animal undergoes immediate triage. Just like in human emergency rooms, a rapid assessment determines the severity of the condition and the urgency of treatment. Rehabilitators look for specific symptoms: tremors, lethargy, difficulty breathing, seizures, or unusual behaviors. Vital signs, heart rate, respiration, temperature, are checked, and a preliminary physical examination is conducted. Often, a strong chemical odor or visible residue on the animal's fur or feathers provides initial clues, but internal damage is the silent, more dangerous enemy they must confront. Identifying the exact toxin is often the greatest challenge. Unlike a simple injury, poisoning can manifest with a myriad of non-specific symptoms. A definitive diagnosis may require blood tests, urinalysis, or even analysis of stomach contents, which can be time-consuming and expensive. While waiting for lab results, rehabilitators must rely on their experience, observing the animal's response to initial supportive care, and considering local environmental factors. This detective work is vital, as the specific treatment often hinges on knowing precisely what poison is afflicting the animal. Before specific detoxification can begin, the animal must be stabilized. This often involves critical life support measures. Animals suffering from shock or severe dehydration receive intravenous fluids to restore electrolyte balance and maintain circulation. Oxygen therapy might be administered to aid respiration, especially if the lungs are compromised. Anti-seizure medication can be given to control neurological symptoms, and warmth is crucial to prevent hypothermia in weakened animals. This stabilization phase is not a cure, but a vital holding pattern, buying precious time for the rehabilitators to prepare for targeted treatment. For animals exposed to external toxins like oil, pesticides on fur, or chemical residues, the first step is external decontamination. This meticulous process involves gently washing the animal with specialized, non-toxic detergents. For birds affected by oil spills, this can take hours, as every feather must be carefully cleaned to restore insulation and waterproofing. Incorrect washing can strip natural oils or cause hypothermia. The goal is to remove every trace of the external contaminant without further stressing the already fragile patient, preventing ingestion through preening or grooming. Once stabilized, internal decontamination addresses ingested poisons. Activated charcoal is a common treatment, administered orally. Its porous structure binds to many toxins, preventing their absorption into the bloodstream and facilitating their excretion. In some cases, if the poisoning is very recent and the animal stable, emetics might be used to induce vomiting, expelling stomach contents. However, this carries risks and isn't suitable for all toxins or all animals. The careful judgment of experienced staff determines the best approach to minimize the internal absorption of the harmful substances. For some specific toxins, direct antidotes exist. For instance, atropine can be life-saving for animals suffering from organophosphate pesticide poisoning, counteracting its severe neurological effects. Vitamin K1 is used to treat anticoagulant rodenticide poisoning, helping to restore blood clotting function. These antidotes are administered with precise dosing, often requiring careful calculation based on the animal's weight and condition. The availability and efficacy of an antidote can dramatically alter the prognosis, turning a grim outlook into a hopeful recovery. It's a race against time, with every dose critical. Beyond immediate detoxification, supportive care is paramount for recovery. This includes continued fluid therapy, pain management, and nutritional support. Many poisoned animals are too weak to eat, so they may receive assisted feeding or specialized liquid diets. Maintaining a stable, stress-free environment, often in temperature-controlled incubators, is also critical. Rehabilitators constantly monitor for secondary infections, which are common in weakened animals, administering antibiotics as needed. This phase can be long and arduous, demanding immense patience and constant vigilance from the care team. Heavy metal poisoning, often from lead ammunition, fishing weights, or industrial waste, presents unique challenges. Animals like eagles or waterfowl might ingest lead pellets, causing neurological damage, anemia, and gastrointestinal issues. Chelation therapy is the primary treatment, where specific drugs are administered that bind to the heavy metals in the body, forming compounds that can then be excreted. This process can be slow and requires repeated doses, with constant monitoring of kidney function. The goal is to safely remove the toxic metals without overwhelming the animal system. Pesticides are designed to be toxic, and their widespread use makes them a frequent cause of wildlife poisoning. Animals can be exposed by directly ingesting granules, eating contaminated prey, or absorbing chemicals through their skin. Symptoms vary wildly depending on the pesticide type, ranging from paralysis to severe internal bleeding. Treatment is largely symptomatic, managing seizures, providing respiratory support, and administering specific antidotes if available. The long-term effects of chronic, low-level pesticide exposure are also a growing concern, often leading to reproductive failure or compromised immune systems. Oil spills devastate marine and coastal wildlife, coating birds and mammals in a thick, toxic sludge. The immediate danger is hypothermia and buoyancy loss for birds, and ingestion of oil during grooming. Specialized cleaning protocols, as mentioned, are paramount for external decontamination. Internally, oil can cause organ damage and suppress the immune system. Animals undergo extended periods of rehabilitation, sometimes weeks or months, to ensure they are healthy, waterproof, and strong enough to survive independently. The recovery often involves a complex interplay of physical cleaning, internal medicine, and behavioral assessment. Industrial toxins represent a broad category, often involving complex chemical compounds released into water, air, or soil. These can include PCBs, dioxins, and various volatile organic compounds. Diagnosing and treating such exposures is particularly challenging due to the sheer variety of chemicals and their often unknown effects on specific wildlife species. Treatment largely focuses on supportive care, managing symptoms, and attempting to facilitate excretion through enhanced kidney or liver function. The long-term prognosis can be guarded, as many industrial toxins accumulate in tissues, leading to chronic health issues even after initial recovery. Once immediate medical crises are managed, animals move to the recovery ward. This is where the long process of healing truly begins. Animals are housed in specialized enclosures, often mimicking their natural habitats, to minimize stress. Daily monitoring includes weight checks, appetite assessment, and observation of behavior. Physical therapy might be implemented to help animals regain strength and mobility. The goal is not just survival, but complete functional recovery, ensuring they can hunt, forage, fly, or swim effectively once released. This phase requires immense dedication and patience. A critical aspect of rehabilitation is ensuring the animal can behave naturally in the wild. For poisoned animals, toxins can sometimes leave lasting neurological or behavioral deficits. Rehabilitators observe hunting instincts, predator avoidance behaviors, social interactions, if applicable, and fear of humans. For birds, flight tests in large aviaries are crucial to assess stamina and agility. Any animal exhibiting impaired natural behaviors cannot be released, as it would likely not survive. This phase is about restoring not just physical health, but also wildness, making them truly self-sufficient. Before an animal is given a clean bill of health for release, it undergoes a rigorous pre-release evaluation. This includes final health checks, blood tests to confirm the absence of toxins, and a comprehensive behavioral assessment. Factors like weather conditions, food availability in the intended release site, and the presence of other healthy individuals of the same species are also considered. Rehabilitators meticulously select a location that offers the best chance of survival, far from the source of the initial poisoning. Every precaution is taken to ensure the animal's second chance is a true opportunity for success. The ultimate reward for months of painstaking work is the release. It's a moment of profound significance, a testament to resilience and compassionate care. A rehabilitated animal, once on the brink of death, now bounds or soars back into its natural habitat, a living symbol of hope. While not every poisoned animal can be saved, each successful release underscores the vital importance of these rehabilitation efforts. It's a bittersweet moment, as rehabilitators say goodbye, knowing they've done everything possible to mend a broken life and restore a piece of the wild. While rehabilitation is crucial, the true solution lies in prevention. Every poisoned animal represents a failure of our stewardship of the environment. Education about responsible pesticide use, proper disposal of hazardous waste, and advocating for cleaner industrial practices are essential. Supporting wildlife rehabilitation centers not only provides vital care for individual animals but also helps scientists gather data on environmental contamination trends. By understanding the sources of these toxins, we can work towards a future where fewer animals suffer, and the wild can truly thrive, unburdened by our toxic footprint.